amyloidosis in interstitial and amyloidosis in glomerular. So since it's infiltrating, we don't have also a change in size. So we have elements like polycystic kidney disease, amyloidosis, we have other infiltrations like lymphomas, we have diabetic nephropathy in the case of a glomerular kidney disease, and we have HIV associated nephropathy. So all of those 4 major ones are not associated with a small size kidney, basically. But the others are actually with small size kidney. So after this, on the diagnosis, you now go to the etiologies, which are this, and then the best way to visualize the etiologies is only to support for the etiologies, to confirm for the etiologies, for the cause of the mechanism and the mechanism. You have to ask for a renal biopsy and histopathology. Basically, you should do a renal biopsy and histopathology. Now, the next element after this now is to visualize for the complication. Is it clear? So now let's visualize now for the complication of renal failure. So the complication of chronic kidney disease, you have the same complication as acute kidney injury. In addition to the complication of acute kidney injury, we have other ones like anemia. Is it clear? The anemia is as a result of low level of erythropoietin. Is it clear? But that you can investigate simply by asking for a full blood count. Is it clear? And generally, the anemia of chronic kidney disease is going to be normocytic normochromic. Is it clear? Now, the next one, you have also hypocalcemia. Hypocalcemia and hyperphosphatemia. So you should ask for the phosphate level, and you have also a resistance, a secondary hyperthyroidism. Is it clear? Because of resistance to hyperthyroid hormone, secondary hyperparathyroidism, because the chronic kidney disease are associated with failure to respond to hyperthyroid hormone. Is it clear? And when there is failure to respond to hyperthyroid hormone, there is going to be more breakdown at the level of the bones. Is it clear? That is going to result to osteodystrophy. Is it clear? And for osteodystrophy, you need to do the X-ray of the long bones. Is it clear? You need to do the X-ray of the long bone to see the mineralization. And also to see for the mineralization, you have to do DEXA test. Is it clear? You have to do DEXA test to also visualize for the mineralization of the long bones. Is it clear? So those are the different elements. So for the hypocalcemia and hyperphosphatemia, just ask for the ionogram to visualize for the calcium level and the phosphate level. For the secondary hyperparathyroidism, you ask for the parathormone level, and for the osteodystrophy, you ask for the DEXA with the X-ray of the long bones. The third element is that you can also have so those are the major 2 elements. We have already said hyperkalemia, so you can have it, and all the other elements, uremic syndrome, you can have it, fluid overload, you can have it. And here you need to know that what the fluid overload that is in chronic kidney disease is more going to be in the interstitial space and the intracellular space than the fluid overload in acute kidney injury. So that's why in this patient with chronic kidney disease, you may have a pericardial effusion. Is it clear? Patients here may have pericardial effusion. Are you getting? The patients here may have peritoneal effusion. They may have pleural effusion. So pleural effusion, pericardial effusion are interstitial space. Is it clear? Since in case of chronic kidney disease, there is loss of protein, there is going to be accumulation at that level, and the patients may also have cerebral edema because also have accumulation inside the intracellular space, and that's why the patients may have normal level of uremia, but the patients are still confused. Is it clear? If you realize that patients, you may realize in chronic kidney disease patient, the patient is still confused, but they have a normal level of uremia. This is because of a cerebral edema. Is it clear? And the uremia is also going to be another factor that is associated with cerebral edema. Is it clear? So those are the different characterizations. So for a pericardial effusion, in order to diagnose it, you ask for a chest X-ray. Is it clear? And then to confirm it, use a cardiac ultrasound. To see a pleural effusion, you ask for a chest X-ray. Is it clear? And then to see for a cerebral edema, you ask for a CT scan, where you are going to see loss of the differentiation between the gray and the white matter. Is it clear? And then we are going to have the absence of the sulci. So those are the different elements that you have for the diagnosis or for the investigation of chronic kidney disease, of renal disease, acute and chronic kidney disease. Now you continue now with the management.